Hello everyone, my name is Nausheen Parveen. I am Assistant Professor in IIMT College of Pharmacy, Greater Noida. In today's lecture, I am going to discuss about chronopharmacology. Contains introduction, biological rhythm, history, chronobiology, chronopharmacology, therapeutic application of chronopharmacology, chronopharmaceutical technologies, marketed drugs. These are the contents. Chronopharmacology, basically related to rhythm and times. Introduction. The physiological parameter shows a rhythmic change mostly synchronized with the periodic change in environment. Is called as biological rhythm. They do not behave constantly in time but varies with changing external cues like day-night cycle. Biological rhythm are repetitive biological process. They can range in frequency from microsecond to less than one repetitive event per decade. The variation of timing and duration of biological activity in living organisms occur for many essential biological processes. Biological rhythm, like circadian, means lasting for about 24 hours, like sleep-wake cycle. Infradian means cycles longer than 24 hours, like menstrual cycle. Ultradian means cycles shorter than a day, like neuronal firing times. Seasonal means seasonal affective disorders. Next is the history of chronopharmacology. James Jacques D. Otis D. Marin described the circadian rhythm of plant in the 18th century. Franz Helber coined the term circadian in 20th century. Circa means about or approximately. Dies means days or about 24 hours. Considered as one of the founder of modern chronobiology. Chronobiology means chrono means time, bio means life, logo or logos means study. Chronobiology is the study of biological rhythms. It examines the effects of time on biological events and internal biological clocks. Chronopharmacology, a science concerned with the variation in pharmacological action of various drugs over a period of time of the day, optimize drug therapy by selecting the appropriate time of drug administration, helpful in achieving maximum efficacy and minimal adverse effect. Definition: chronobiology, the branch of science focusing on biological rhythm and their mechanism. Chronos means bio, time. Bios means life. Logos means study. Chronopharmacology, science dealing with optimization of drug effect and minimization of adverse effect by timing medication in relation to biological rhythm. It is concerned with the effect of drug upon the timing of biological event and rhythms. Therapeutic application on respiratory system. By we can use therapeutic application of chronopharmacology when increased bronchoconstriction at night, increase parasympathetic tone, decrease adrenaline, decrease cortisol at midnight, increase sensitivity to irritant and allergens at night, exacerbation of allergic rhinitis, and asthma. In asthma, acute attack of asthma more common between midnight and 6 a.m. so that we can use the chronobiology, yeah, chronopharmacology therapy. In theophylline and beta 2 agonist is time as at evening canteen. It is a technique which are using in asthma. It is a technique of complex form between cellulose polymer and non-polar solid aliphatic alcohol which act as a matrix. Next application, therapeutic application of chronopharmacology is cardiovascular system. Mostly we can see the BP peak between 6 a.m. and between 6 a.m. to 9 a.m. and in evening 6 p.m. to 7 p.m. So that time we can use chronopharmacology. Next, BP dip at night and decrease slightly afternoon. That time we can use chronopharmacology. Next is diastolic BP varies more than systolic BP. That time we can use chronopharmacology. Next is when in this chart the systolic BP shown by blue color and diastolic BP shown by red color. We can see the sleep timing 22 means 10 p.m. to 6 a.m. The systolic and diastolic both BP are deep, and after 6 a.m. we can see the at morning time the both BP are giving both BP are rising. Both means systolic and diastolic. Next therapeutic application of chronopharmacology on cardiovascular disorder is we can use in myocardial infarction, sudden cardiac death, angina pectoris, transient ischemic attack, or strokes. Mostly we can see high incidence of cardiovascular disorder occur between 6 a.m. to 12 noon. That time vascular tone is increased and platelet aggregation also increased. Intrinsic thrombolytic activity is decreased. Aspirin shows maximum antiplatelet effect in the morning. Thrombolytic and heparin shows decreased benefit during early morning hour. Atenolol shows more effective during daytime. Labetalol shows more effective in early morning hour, and enalapril are used in peak effective effect in the afternoon after morning dose and early morning after evening dose. Next therapeutic application of chronopharmacology on gastrointestinal tract. So mostly we can see acid secretion peak between 10 p.m. to 2 a.m. That time ulcer pain is worst. Ulcer healing is directly related to acid secretion inhibition at night. That time we can use S2 receptor antagonist for evening dose. Next is next therapeutic application is next therapeutic application is endocrine system. On endocrine system, we can also use chronopharmacology in endocrine system when highest secretion of cholesterol seen in early morning, lowest at midnight, growth hormone peak during sleep, mostly testosterone peak early morning, and thyroid stimulating hormones peak at midnight. Corticosteroids given as single morning dose cause less pituitary adrenal suppression. Next is diabetes. Next endocrine system. In endocrine system, so next, insulin regulate pulses every 5 to 15 minutes. Diabetics decrease glucose tolerance in the latter part of the day, decrease by decreasing utilization, decreasing insulin sensitivity. In type 2 diabetes mellitus patient, progressive glucose tolerance from morning to evening, higher dose of the insulin in the morning. Next, therapeutic application of chronopharmacology, chronopharmacology on musculoskeletal system, like rheumatoid arthritis. Mostly symptoms shows in morning, between 8 a.m. to 11 a.m. That time symptoms were be very severe, and that time we can use NSAIDs, long acting NSAIDs. Next is osteoarthritis, more pain more intense between 2 p.m. to 8 p.m. at morning dose, for afternoon is worsening, evening dose for night time is worsening. Next therapeutic application of chronopharmacology is CNS. On CNS, melatonin shows secreted at night by pineal gland, function as synchronizes sleep-wake cycle with circadian rhythm. Melatonin agonist, hypnotic for sleep onset insomnia, reduce jet lag symptoms. Bedtime administration of hypnotics is more effective. Next is cancer. Cancer cells are considered to have lost internal time keeping mechanism. Tumor cell and normal cell differ in their chronobiological cycle. The basis for the pharmacotherapy of cancer. Next is skin disorder, cirrhosis. Cell proliferation rate peak between 9 p.m. to 3 a.m. Inflammatory activity highest at night, least in the morning. Atopic dermatitis, sensitivity of histamine highest at night. Lignocaine, skin penetration at 11 p.m., 11 a.m. twice that at 8 a.m. Topical corticosteroid activity in afternoon higher than that in the morning. Next is chronopharmaceutical technologies. Chronopharmaceutical technologies, first is canteen technology, second is psychochemical modification of the API, next is OROS technology, next is CODAS technology, next is C.Pharm technology, next diffucaps technology, next chronomodulating infusion pump, next timer technology, other CR erodible polymers, next control release microchip. Next is marketed drugs. First API is theophylline. Theophylline is approved by FDA in 1st September 1982 for the treatment of asthma in canteen technology. Next API is famotidine, is approved in 15 October 1986 for ulcer treatment and physicochemical modification of API. Next is simvastatin, uh, approved by FDA in 23rd December 1991 for hypercholesteremia in physicochemical modification of API. Next API is verapamil HCl, approved by FDA in 26 February 1996 for the treatment of hypertension in OROS technology. Verapamil hydrochloride HCl also approved for CODAS technology in 25 November 1998 for hypertension treatment. And next is diltiazem HCl and verapamil HCl is approved by FDA in 6 February 2003 for hypertension treatment in C-Pharm technologies. These all are the marketed drugs for chronopharmaceutical technologies. So this all are the chronopharmacology. Thank you.